This is Thomas Vail, Chair of the Department of Orthopedic Surgery at UCSF. You are listening to Interview with the Surgeon with the Surgeon Agent.
On this episode of Interview with the Surgeon, we welcome Dr. Thomas Vail, Chair of Orthopedic Surgery at UCSF. Under his leadership, the department has become an international leader in patient care, research, education, and global health. He holds multiple patents for orthopedic devices and has served as an industry consultant, participated on scientific advisory boards. Dr. Vail has published extensively on hip and knee surgery, surgical training and innovation, and health economics and patient care. He is past president of the Knee Society, American Association of Hip and Knee Surgeons, and Eastern Orthopedic Association, and past vice president of the American Board of Orthopedic Surgery. At UCSF, he has held multiple leadership positions, including medical director of the UCSF Orthopedic Institute, which he conceptualized and helped build. He has also served as co-chair of the UCSF Health Finance Committee, chair of the Funds Flow Committee, and a member of the Executive Council.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Thomas Vail, Chair of Orthopedic Surgery at UCSF. Doc, how are we doing today?
Doing well, Matthew. Thanks for having me on your cast.
Thanks for being here. So let's just jump right into it. What were your goals and aspirations during your residency, and how did those change throughout your fellowship?
You know, when I decided to go to an orthopedic residency, it was really pursuing my passion that I think was derived from being in engineering school as an undergraduate. I was always attracted to the, math and science, and then that led me to an engineering curriculum. And when I was in engineering, I sort of discovered that the most interesting part of math and science was the application to the human experience, the ability to improve the human experience through engineering. That was most interesting. And most of your listeners won't remember the $6 Million Man, but Lee Majors was the star of that show way back when. And sort of the premise was that he was an artificial, sort of scientifically created human being in certain aspects. And that kind of caught my imagination. Could you use engineering to improve the human ability to improve the quality of life? And ultimately led me to medical school, where I was attracted to things where those thoughts would apply, maybe cardiology, but ultimately orthopedics was the one where it was sort of a natural fit. And so you think about all of the devices and the technology that's associated with the orthopedic surgery, it just makes sense. And that's how I got interested in orthopedics and engaged. I chose an orthopedic residency where I would have a broad exposure to a variety of subspecialties in orthopedics. That was Duke University with Jim Urbanek as the department chair back then. He was a great mentor, and Leonard Goldner was his predecessor, and Lennox Baker. They were all still in the community and part of the program. And so during residency, to answer your question about how does your focus change, during residency, you're exposed to all the different subspecialties, and you begin to develop interests. And, I had an interest in athletics, so naturally I was interested in sports medicine, but my engineering background sort of led me to joint replacement. And that was a technology that was, developed in the late 60s, early 70s, was evolving quickly. It involved interesting surgical procedures and application of devices and improvement of devices for use in surgeries and treating arthritis. So I found it to be a fascinating subspecialty area to get involved in. I had some good mentors in the residency training program. Donald McCullum, who was the section chief back then, and John Callahan, who was a leader and still is a leader in arthroplasty, was on the faculty then. So I had an opportunity to really dive into the field. Pursued my fellowship, and the fellowship training was a unique one. My fellowship was really a multinational fellowship. It was sponsored by Duke, and I had the opportunity to visit a number of locations, and in the United States and some in Europe, and kind of understand what their focus was, how they were accomplishing their the care of patients and the improvement of the field, and then bring that back with me into my practice. Ultimately in choosing a practice, what I really wanted was the ability to have responsibility early, to see challenging cases, to be in a position to be busy right away. And that's why I chose an academic center, decided to stay at Duke for that experience. And so I was busy and challenged from day one. I had good resources around me, good teammates to work with. And I think those are key elements of a first job, that you have good support, that there's alignment between what you're being asked to do, what's expected of you, and what you want to do. You're best at what you like to do. You're best when there's alignment of those activities and expectations. So that was a good transition for me.
So what really was that mindset, if you can take us through, when you're going through your fellowship, when you're looking at the job market, what type of things were going through your mind at that time?
Yeah, well, you're kind of envisioning yourself in your new role, and what would it be like, and who would you be working with? Where would your patients come from? What resources would you have? And I looked at a variety of practices. I looked at some private practice situations. I looked at some other academic situations, and ultimately applying the same lens. That is, could I be busy quickly? Would I be challenged? Would I be at the end of a pipeline where people who really needed help would come and seek advice? That's the position that I wanted to be in, and that was the measure. So to me, the line between academic and private practice was not so important as what would I be doing. I guess it's important to mention, in an academic practice, you have an opportunity to sort of change the trajectory of the field a little bit through research, if you're lucky and you're diligent about it. And so I wanted to be in a position where I might have the opportunity to, assess what I was doing, look at outcomes, do clinical research, be and exposed to basic science investigators who were doing things that might be applicable to the clinical field that I was in. So I think that's another important aspect of choosing an academic practice. Ultimately, was the ability to be part of a team of investigators who are doing clinical and basic research, and that's been true throughout my practice. That idea of being part of a team really expands and leverages what you can accomplish in your career, and I think that was an important motivation even from the beginning.
Can you briefly take us through your journey along the process of how you became chair?
Yeah, that's a good question. And I'll say at the outset, it wasn't my goal ultimately to be a chair. There are good chair jobs and bad chair jobs. And what I was seeking really was opportunity, the ability to have an impact, to be in a platform where I could have an impact on my field, whether it was through, training of residents and fellows, or investigation, or simply and importantly the care of patients. And I've always enjoyed that all aspects of it, and particularly the care of patients. So I advanced through my career at Duke, gained more experience, gained more responsibility, became medical director for the musculoskeletal medicine program at Duke. And then ultimately the section chief for adult reconstruction, which is basically hip and knee surgery. And I was happy. I was in a good position doing what I wanted to do. And so that's a powerful position to be in when somebody comes along and says, well, hey, would you look at this? Would you look at something else? So making a move didn't mean that I was trying to leave something undesirable or that I was unhappy. I would be making a move for the positive reasons, for the right reasons, the ability to do something different, to have a larger impact, In the case of UCSF, it was the opportunity to create an orthopedic institute. This idea that you would have actually a building, but it's really a program that brings together all aspects of musculoskeletal care, kind of regardless of the academic complexity in the background. So I'm talking about orthopedic surgeons, physical therapists, people doing imaging, anesthesiologists, plastic surgeons, neurosurgeons, anybody providing musculoskeletal care, put them in the same setting and make it easy for patients. And that was the vision that I had, that I wanted to pursue. And UCSF was willing to take that journey with me, take that risk. I had the opportunity to develop and expand an already successful research program. So I felt it was a great opportunity, and that's really what I was looking for, was opportunity. You know, in life, I think you can't expect people to hand you things. It's not, you can't feel entitled, but you can look for opportunity where you can be successful, and ask yourself, is this the platform where I could do the things that I'm passionate about? And so that's how I became a chair. I didn't start out thinking I want to be a chair. I started out thinking, okay, well, here are the things that I'm passionate about, the things that I want to do, and how am I going to best get that done in an environment where I would be happy doing it. And I'll say San Francisco is a pretty good place to, be doing the work. And so it's been a great tenure here. I've enjoyed it very much, even to the present day.
So what would you say were some of the keys to your success that shaped your early career as you climbed to the top of the industry?
Keys to success, I think I mentioned being part of highly successful teams. I had the opportunity to work with some great investigators, scientists, people like Tony Sieber, Farsh Gilak, Lori Seton, on the science side, who I learned from. I learned a great deal from about how to do studies, about how to pursue basic investigation of the important areas that were affecting patients that I was taking care of. I had really good clinical mentors. I mentioned Jim Urbanek, John Callahan, some great partners, people like Ed Lilly, Mike Bolognese, that came along after I did, and with whom I worked. So I would say keys to success are the ability to work in highly effective teams, to earn respect that way through giving respect to other people, creating alignment between the things that you're doing and the things that you're interested in and good at. I think that was really important. Putting yourself in a position to say yes to things. I've made this point to my own residents. We're busy. It's easy to get overwhelmed, and you have to be able to draw the line at some point, because saying no is the right thing, but because you need to have some bandwidth to say yes. When somebody comes along and says, hey, are you interested in this project? Or would you help me with this that you hadn't thought of before? And it might lead you in a direction that opens many other opportunities. So you have to retain the capacity to say yes in your career. And that's led to some really interesting things for me, whether it's clinical skill sets, new ways to take care of patients, or developing devices, or helping launch companies. These kinds of things stem from the ability to say yes and work with other people who have ideas or can help you better pursue your own ideas.
So what advice do you have for the graduating residents and fellows that are entering the professional job market for the first time?
Yeah, well, clearly, as you and I were discussing earlier, they're entering the job market in a very odd time. And I think they need to, first of all, recognize that this experience right now with the pandemic isn't isn't going to be sustained. It's not representative of the future, but it does color the immediate first steps and what happens. And it's access to jobs, because many places aren't hiring right now. And I think that's a temporary phenomenon. They will be hiring again. So maybe there's some interim steps that just by practical nature will occur if somebody doesn't find the job in the setting that they're ultimately going to be happy with for their career. It may change over time. So I would say right now, just recognizing the uniqueness of the circumstances, you have to be malleable. You have to be resilient. I think there may be some delays that occur in finding exactly the right job. But ultimately, I would say to them, apply the same standard, the same perspective that I had outlined that worked for me, recognizing that everybody's different. I'm not saying that that's the only formula, but look for alignment. Look for a job that is in alignment with your skill set, where the expectations from that employer are aligned with what you want to do. And I know somebody once told me that, there aren't just a million great jobs where you walk in the front door and it's a great job, but there are a lot of opportunities out there, situations that you can make great. And that's what I would be looking for, is a situation that you can make great. And that often means it's not the job that has the huge upfront bonus. It's not the job with the highest starting salary. It is the job that has the best long-term viability. That's what I would be looking for. Opportunity is the key. You don't want to accept something and trade off the ability to grow or the sense of opportunity, because I think that'll get very tired very quickly.
Now, on that thought process regarding a lot of the annual conferences now all being done virtual, and this graduating class will not have the opportunity to rub shoulders with folks like yourself at these conferences, what advice do you have for them regarding their outreach process as they continue to try to network?
Yeah, it's interesting. Orthopedics is unique in that, and I think medicine is that way, generally speaking. If you ask for help, if you reach out to people, they will respond. I found, just as an example, I've had the opportunity to visit many places in the world, and you're welcome as a member of the profession, without question. Now, right now, that's a little bit different. So you're not going to be physically present in every place you want to gain access to, but if you're interested in a location, reach out to the leadership in that area. Reach out to somebody in a private practice and ask them what's going on. You don't have to reach out with the intent of gaining a commitment right away. Reach out with the intent of asking for advice. People are very willing to give advice particularly to new grads, particularly to people who are in the situation that they were once in. So don't be afraid to ask for advice, and it doesn't have to be connected to a commitment, so it's not uncomfortable. It's okay to reach out and say, hey, look, I'm interested in your community. I have an academic aspiration. What's the situation at your place? Do you know? Can you give me advice about other circumstances that I might take a look at? So I would say don't be afraid to seek advice and ask people for help.
Now, as the former president of the AAHKS, what type of involvement do you still have with the different societies, and how are these societies helping prepare the next generation of surgeons?
Yeah, I think, to me, that involvement in subspecialty societies has been among the most rewarding activities. And it's rewarding because those are the cohort, within those organizations, the cohort of people that are most similar, that have similar needs, aspirations, interests. So that those organizations have been really important. I think there's also been a recognition among those organizations. For me, it's the Hip Society, the Knee Society, the AHKS, as you mentioned, a recognition of attracting young people, attracting residents, getting them engaged, getting them exposed to what we do, giving them advice on how to get started, and particularly AHKS has really good programs for residents and fellows to give them exposure, so I would encourage residents and fellows to take advantage of that, because again, even though it's maybe virtual this year, it won't be virtual next year, and it's going to change. And that's a great way to access the experts from around the country and get advice and learn things.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.